Good evening, everyone. Welcome back another session of Cancer Care at American Oncology Institute, Ludhiana. Today we have with us Dr. Manjinder Singh Sidhu, Senior Consultant Radiation Oncology, DMCH Cancer Care Center, in collaboration with the American Oncology Institute, Ludhiana. Today we will gather some information about cervical cancer. Welcome, sir. Good afternoon.
Thank you.
Sir,
Thank you.
what is cervical cancer and how common it is?
Yeah, as the name suggests, cervical cancer. Basically, cervical cancer is the cancer of female reproductive tract, which the organ is known as cervix. So, how common it was? It is the most common cancer in the developing countries like India and Asia, and overall in the world, it is third most common cancer among all cancers.
G. Sir, what causes of cervical cancer?
Yeah, this is a very important question. You should know that what are the causes of cervical cancer, especially in developing worlds like India. So there is a lot of data that the majority of the cancers cervix is caused by infection known as human papilloma virus. We call it HPV virus. And mainly the strain HPV-16 is the main cause of the cervical cancer. So the females which have this HPV infection, they have five-fold more increase in risk of cervical cancer. Also, there are studies which suggest that if the female is carrier of this infection, then at 30 years after carrying this infection, there is 40% more chances of cervical cancer. So this is the main cause. Then other causes of cervical cancer are mainly the HIV infection. So in immunocompromised females, so this infection is more common. Then poor hygiene, or if the patient has multiple sex partners, and also this cancer is also seen in more common in homosexuals patients. And regarding the genetic point of view, because majority of the cancer transfer from one generation to another, but in case of cervical cancer, the risk of genetic transmission is less than 1%. So these are the main causes of cervical cancer.
G, sir. Sir, what are the symptoms of cervical cancer?
Yeah, basically, these females usually present to us with the chief complaint of post-coital bleeding. So they usually complain that in between the intercourse they have the bleeding, or their menses are irregular. So some female patients which are from rural areas, so they usually come present with us with the continuous foul smelling discharge. So these are the main common presentation of cervical cancer.
Okay, sir. Sir, how to diagnose cervical cancer?
Yeah, diagnose means that we have to come to a conclusion that this female has cervical cancer if these female present with such symptoms which I have told you. So if the patient present with such symptoms, then first step is to examine the patient. And if on examination you see that there is a growth which is bulging out from the uterus, then you have to take a biopsy. Biopsy is basically a tissue proof. So all cancers has to be treated after the biopsy proof. So first step is to take a biopsy, and in a biopsy, if you get confirmed the case that it is a case of CA cervix, like majority of these patients have squamous cell carcinoma. So if patient is diagnosed with the CA cervix cervical cancer, then second step is to consider PET-CT scan for the staging.
G. Sir, what are its stages and is it curable?
Yes, so this is also very important for the viewers to know, because cervical cancer, it is staged by a PET-CT scan. So once a PET-CT scan is done, we can stage a female with cervical cancer. Usually there are 4 stages of CA cervix. So it is stage 1, 2, 3 and 4, which can be detected on scans. So if the patient has stage 1, stage 1 means it is a localized disease which is only confined to the cervical organ. So these patients after treatment have more than 100% chances of cure. So near about 100% chances of cure. And if it is stage 2 and 3, it means the stage has just gone beyond the cervix, but it is again confined to the pelvis area. So these patients usually have chances of cure of 60 to 80%. So if it is beyond stage 3, it is stage 4, it means the disease has spread to the other organs like the bones and the liver. So usually these patients are not curable. So we want that the patient should present to us in early stage. And one more point I want to highlight, there is a test known as pap smear. So it is very freely available. So this is the only test which can detect the cancer before the first stage, means in stage 0. So if you have so PET scan, pap smear is routinely recommended for women for the screening after the age of 50 years. So if you get an abnormal report on a pap smear, then you have to confirm it by colposcopy. So basically colposcopy is an instrument which looks at the cervix and it detects the area which is abnormal on the pap smear. So if you get an abnormal area on a pap smear, you can take a biopsy from that area. So pap smear is a recommended screening test for cervical cancer. So these are the ways in which you can diagnose. So in brief, you should regularly do a pap smear yearly and take a biopsy, and for staging we have to do a PET scan. And I want that it should be detected as early as possible.
Ji. Sir, are there any treatment option available for this cervical?
Yes, you should. Definitely, there are treatment options available. So this is very important to note that if cancer is detected in 0 stage, I mean to say by the pap smear, so you have to remove that area. So basically, it is loop excision of that abnormal area. And again, if the loop excision has been done, that like I want to say that the patient is detected in first, second, or third stage, then you have to see the size of the lesion. So if the size of the lesion is less than 4 centimeters, then patient is advised surgery. So it is a radical surgery. The whole of the uterus and the ovaries and the cervix are removed. And if the size of the lesion, I mean to say clinically or by the PET CT or the other investigation is more than 4 centimeters, then radiotherapy along with the chemotherapy is the treatment of choice. But if the stage is 4th stage, then only chemotherapy or palliative radiotherapy is recommended.
Okay, sir. Sir, how to prevent it?
Yes, this is also very important. Already I have told you the causes of the PET smear. As you are all aware that HPV infection is the most common cause of the cervical cancer. So regular screening by pap smear is recommended. So this is the only way in which we can detect these cancer at a very early stage. And one more important point I want to highlight, that your question is how to prevent it. So first thing is to maintain your hygiene. Okay, you should be maintain your body weight. You take a you do regular exercise and take a balanced food. Secondly, the most important step to prevent cervical cancer is vaccination, because it is the only cancer where vaccination is approved by not only by the government of India but by the WHO also. So this is very important. There are 3 vaccination doses which every woman, every child, I mean to say child, not woman, at the age of 9 to 13 years. So all children at the age of after 9 till 13 years, before marriage or before any intercourse, should be vaccinated for this cervical cancer. There are 3 doses given. So it is given on the day 1, then after 1 month, then after 6 months. And as you are aware that polio is eradicated in India, so we are expecting another in 10 or 20 years. Due to this vaccinations, maybe you will not see even a single case of cervical cancer. So vaccination is very important thing to prevent cervical cancer.
Okay, sir. Sir, thank you so much for sharing with us very important knowledge, and thank you so much viewers for watching our session of cancer care. And if you have more queries, you can comment in below our video. Thank you so much.
Thank you.
Thank you, sir.